Along the lines of what you're doing now across the country as part of the association, but also your experience working in South Florida, Miami Beach, and now in Doral. And as you recall, we had an issue many, many years ago with police departments and law enforcement interacting with people that suffer from mental illness, and we saw some incidents, where the police had to use strong measures to restrain someone. And so there was this dichotomy between traditional police training and how to appropriately handle someone who was mentally ill. Those procedures have changed over the years, and in South Florida, and I believe through much of the country. So the first thing I would ask is, how in that training have we seen improvements in the way law enforcement can now identify someone who's just being belligerent because they are, and someone who is exhibiting signs of mental illness, and as a result, the approach to arresting and protecting them would be different than somebody else?
Absolutely. I'd like to talk about the 11th Circuit Criminal Justice Mental Health Project that's going on in South Florida, which is really spearheaded by Judge Leifman.
Correct.
Way back in 2000, the period that you're talking about, where we realized we're loading up our jails with mentally ill people. At the peak of this, there were 7,200 people in our Dade County jails, and today, because of the proper training, we're down to about 4,000. We've been able to close facility, save about 25,000 beds a year, which makes a big impact. So in 2000, to divert individuals with serious mental illnesses who do not pose significant public safety risk away from the criminal justice system into community-based treatment and support services. There were two components: pre-booking diversion, where we trained our officers and crisis intervention team. In South Florida, we've trained about 5,000 law enforcement officers. And also there's post-booking diversion, serving individuals who are in jail awaiting adjudication, who are at a lower risk, who can get into programs. We've seen that the rate of recidivism has dropped 75% on those individuals, with the collaborative work of so many work groups who really bought into this. I think an important note would be me to talk about two of our large agencies from 2010 to 2016. Miami-Dade Police and the City of Miami had almost 68,000 interactions with mental illness persons. There were 14,000 diversions made and only 127 arrests. I think that speaks volumes of the front-end training for officers to identify, is a person in crisis? Are they mentally ill? What steps do I take? Using de-escalation, and where to go next. So I think those are some of the important steps that we're talking about today, and how we can get there in the future by supporting funding, supporting the IECP and other associations, and pushing out our One Mind campaign to continue to build on this.
And what the chief is referring to, for those obviously who may not be familiar with it because they're not from South Florida, we had a couple floors at the county jail, for example, that were a house of horrors in the early 2000 to 2005 period. I happened to be Speaker of the House during some period of time and toured it. And you basically had mentally ill people being held in a traditional jail setting that was not prepared, and was horrifying. The conditions they were in and so forth. And that's where Judge Leifman, who's truly done a phenomenal job, began to interact with this program. And we still have some issues, but we certainly have come a long way from where we were. You discussed the importance of these programs and how these solutions are beginning to change the way we approach it. Obviously, this is a committee that appropriates money. And so is there anything else that you would point to that this committee needs to know that we should consider as we move forward on future appropriations bills, the kind of projects we should be looking to fund? What is the takeaway from this when it comes to our function as appropriating federal funds?
Well, first, we must realize the problem is very real. When we went on our 8-city tour, the IECP, this is universal in the United States. This is one of the front-pressing issues when you're talking about mental illness or homelessness that coexist. I think understanding that funding training for law enforcement in the academies, for an association that'll push out criminal crisis intervention team training or mental health first aid, technology for agencies that are being progressive, that are using technology in the way of getting the first line to social services instead of having somebody bring them into a jail or a social service to divert them the right way, is paramount at this time. But I think also important, if I may, is the ICB has been asking for a long time for a National Criminal Justice Commission to look at not only mental illness, but all the things that are taking place, because there is no one fix anymore. Everything is bleeding into other society issues, and we've become the de facto stop for so many. I hear the doctors, and so many of these things sound so great, but to that officer on the street who's trying to do de-escalation and make the right decision, we're usually the first interaction.
Senator Rubio, if you want to ask a couple more questions, I'm going to do a
The-
second round here, so go ahead.
You're in the
Yep.
second round already?
Right.
So I get to double, this is a
You
good
get to
thing.
double-
I should have
double up.
known that. I didn't know that. It's my first time on this committee. I just got on this committee, and I like the rules in this committee. So-
We call them the Rubio rules.
It's pretty good to have things named after you most of the time. But so just to continue to talk about what, and I won't need the full 5 minutes, but you keep using the term de-escalation. And I know that you primarily are involved with law enforcement at the local level, and that's what you represent. But that's not the only people that interact with people that are suffering from mental illness in the community. That interaction is occurring in our schools, in our prison system, at airports. Do you think there's an opportunity here to take the de-escalation model beyond the traditional local law enforcement? But what other agencies in society, because you talked about this bleeding over into other aspects of our society, what other agencies or instruments in our society are interacting with this problem and in your view could benefit from the better training on how to handle or how to identify these problems?
Yes. Well, the range of age that is impacted starts at a very young age. I saw somebody on our own station last week, 10 years old, mental illness, dealing with issues. So I think schools would be important for them to understand what they're confronted with, the early signs to help prevent things in the future. You mentioned the airport. We saw a horrific act take place in Fort Lauderdale International Airport. Jails, absolutely another great place. Our prisons. Anybody who's in the front line that have an opportunity to make a decision to change somebody's life, I think would be important.
Senator Rubio, can I say one more thing about that? I think the more people we have in America who are trained in mental health first aid, the better it will be. If we can have family members, schools, librarians, any place people go, if the people they run into there are able to recognize warning signs and expedite getting people into help, we'd see far less crisis.
And I think interrelated to all this, and this will be my last question, is what some are calling an epidemic. The numbers are certainly startling about the suicide rates in America among young people. We saw a horrific incident about 2 weeks ago in South Florida where a young woman committed suicide live on Facebook and the like. This is obviously interrelated into all this. As part of the de-escalation process and so forth, how is the frontline law enforcement officer in America trained if in fact they get a call of someone who is either threatening to kill themselves or perhaps attempting to commit suicide? How, obviously, there's so many different law enforcement agencies across the country, but how well prepared are we as a nation in terms of the first responders to the scene of either a suicide or an attempted suicide to de-escalate that, to talk them off it and bring them back down from it? Or does that involve specialized units that sometimes can't deploy in time and in some instances may not be available in some communities?
That is a challenge in itself for anybody who's been trained in law enforcement. You go through a police academy, you're given the basic skills. But because of funding, different police departments are definitely at different levels. I'm fortunate to be in a place of City Doral where we can afford funding, training, and ongoing training, but that's not universal. The other concern you just talked about is something as suicide, but there's also an issue called suicide by cop, where people put themselves in a high-risk situation, wanting an officer to take their lives. Also, the mentally ill persons, a report was done in 2015 by the Washington Post where it's talked about how many people are killed by officers by mental illness. And it's about 25% of our police shootings involve mentally ill persons. I think the de-escalation training or anything that we can have ongoing is the answer to this question. Some of those decisions, as you know, are split-second decisions, and you try to make the right one. The capacity is really, at that time, hoping to have enough officers in the field who are CIT trained or mental health first aid trained. So I'm hoping that, we talk about the One Mind campaign in South Florida and across the United States, and Senator Blunt, even in your great state, Senator Springfield, Missouri, they are engaged. We got to get this message pushed out. I think the support of this room and appropriations will help us get there.